So welcome everyone. We're super excited to have you here on our panelist meeting this afternoon, or our webinar, I should say. I know everyone's coming on right now, and I just want to wait till everyone gets on a little bit more, and we'll go over a little bit of the details about the webinar and how it's going to work today. I'm excited that we're going to start off today's webinar with our 4 hygienists on the panel, and they're going to be going over some of your questions. So as we get started, one thing I want you to know is that below you're going to see a Q&A. We ask that you please type in your questions, because we definitely want these hygienists to know exactly what you're thinking and maybe get their opinion. So we're going to give you the opportunity to answer all those. If for some reason we don't get to all of your questions that live, which we may not be able to, we will get all of them answered and send everyone a copy of the Q&A. So again, we really want to encourage everyone to please type in any questions that you may have for the panelists as we move forward. I also want to remind everyone that we are not giving CEs for this program, so just so you can make sure that you know that, because a lot of people were questioning, are we getting CEs for this program? But this program we will not give CEs for. So with that being said, I would like to introduce the mediator for today, someone that I absolutely enjoy working with, someone who we get to call boss, and who's done an amazing job in all of this things that are going on in our society today. So Chuck, you want to take it over and go from there?
Sure, Kay. Thank you very much. My name is Chuck Cohen. I'm the Managing Director at Benko Dental. And on behalf of Benko, we are very proud to have hosted a series of webinars, first called Coping with Crisis, and now called Back to Business, that have been hopefully keeping you entertained and informed over the last 10 weeks or so. And we are happy today to have 8 panelists, doctors and hygienists, who will help us understand what dentistry will be like going forward to the best of their ability. So we're going to start with our 4 hygienists, and I've asked them to introduce themselves just in a sentence or two, where they practice, maybe where they went to school, and kind of what their specialty is if they have one. And then after that, we'll get right into the questions and make sure we keep things moving. So with that, we'll start with Ann Duffy. Could you introduce yourself and talk a little bit about where you're from and how you got here?
It'd be my honor. Thank you, Chuck. Thanks for having us, and thanks for setting it up.
Oh,
I'm
great.
Ann Duffy, and I'm editor and publisher of Dental Entrepreneur Magazine, Business Beyond the Classroom, and Dental Entrepreneur Woman called Do Life. And I have been practicing dental hygiene, a graduate of The Ohio State, and been practicing, I'm still practicing a half day a week, and I've been practicing for 44 years.
Fabulous. Well, welcome
Thank
in.
you.
We're glad you're here. Alyssa, would you introduce yourself and talk a little bit about where you're from and how you practice?
Sure. My name is Alyssa Aberly, and I'm a dental hygienist. I went to the University of Colorado School of Dental Medicine, and I've only been practicing 11 years. And I work part-time for the Colorado Dental Hygienists Association and part-time for a federally qualified health center here, doing a school-based dental program.
Excellent. Thank you. Welcome. Donna Schultz.
Hi, I'm Donna Schultz. I am lead clinical coach for Benko Dental, as well as a technology trainer. I've been practicing hygiene for the last 22 years and in dental for the last 34 years. I'm living between Colorado and Arizona right now.
Excellent. Well, welcome. We're glad you're here. Antonia, you are the first person who generated a question, and the question came in, what beach are you at? So if you could start by introducing yourself and then telling us a little bit about the beach you're sitting on. We're all a little jealous.
Okay, I'm Tanya Lanthier. I'm a lucky girl that gets to run a company that helps improve people's lives and help with them with their career choices, called dentalpost.net. I've been a hygienist for 25 years. I stepped out of clinical for about 24 months, and actually next week I'm going into temp just to get back in with in the trenches with the girls, you know, just to show bravery. And my island behind me, I can tell you where I wish it was. I wish I was in the BVI's, where I wish I was.
Gotcha. Well, that's great. Well, before we even get started with the questions, I just wanted to point out, I'm not that good with math, but it seems like there's hundreds of years of collective experience at hygiene, just in the 4 participants. So thank you very much for being here. 44 years, 25 years, a lot of years. It's great. So I think the first thing that to talk about post-COVID-19 is how do we all think the role of the dental hygienist in the office is going to change? And or how do you think your personal role might change going back to practice versus where it was before? So however you want to answer that, you can just indicate if you want to raise your hand. If you would like to say first, I'll try to be the traffic cop. But how do we all think the role of dental hygiene is going to change in the new normal? Alyssa, why don't we start with you if you have a thought?
So one of the roles where I already was serving in our health center was as the infection control coordinator. And I know a lot of practices do utilize their hygienists in this role just because we are very detail oriented and seem to be really proactive about infection control practices. So I think that that's a great opportunity for the hygienist to kind of take initiative, and instead of being worried about those things that could slip through the cracks, kind of take the initiative to be the one to set up those protocols and make sure that the right things are happening in their practice. And I think it just takes something off of the owner dentist as well, if they have somebody that can kind of team up with them and take that role. And then obviously I said I work in a school-based setting, and so I think a lot is going to change with, you know, the non-traditional practice settings, schools and nursing homes and community outreach programs. And I'm not really sure what that looks like yet, but I think one of the things we have to just embrace is flexibility and adaptability and be willing to see what the new normal will look like. So I'm not sure where that'll go yet, but I'm excited to figure it out.
So Alyssa, you stumbled onto a topic that I'm really passionate about, and I wanted to spend a couple minutes on it, which is every office needs, the term I use in it is a safety czar, but we could call it infection control coordinator. Could you talk for a few minutes about what that role is? And maybe some other people have some opinions, but I do think that that's something that's so important going forward. So what role do you play in an office to do that job?
Yes, so I work for a community health center that has 7 dental practices. We have more medical locations as well, but 7 of them have dental. So for us, there's a lot of moving parts and a lot of employees and a lot of things that are going on in our practices. And so my role is to keep up to date with the CDC guidelines, things that are coming from OSHA, do site visits and make sure we're following the right protocols, make sure we have the right record keeping in place. And again, I think just there's always a lot of moving parts and people are very busy. And so to have somebody that's designated to keep up with the research and stay up to date with the guidelines and then kind of help the practice make sure they have the right things in place, again, just take something off of the other team members and helps make sure that you're staying compliant.
Is there anyone else who on the panel who has been in that role in a practice and can talk to a little bit about what works, what doesn't work? Tonya, have you played that role, and or do you have some opinions on where that should go?
Yeah, I've never played that role, but I am seeing on Dental Post, you know, postings for people that can help the hygienist turn over their rooms and help between the doctors. That is a new position that's kind of developing right now, and that's what's changing. My motto has been hope for the best and prepare for the worst, and we're going to have to be agile in our management of the team. And I think leadership is going to be key here, and allowing the hygienist to step up if they are capable. You know, and I don't believe that everybody is capable in that position, but someone in the practice is going to have to be in the leadership part of that and lead it. So that's what I'm seeing in postings. The new, there are positions being posted for that.
So let's talk about the hygienist as leader, Tanya. I don't know, Ann, do you have a comment on that or something else? Go ahead.
Well, I do have a comment on being the leader and taking on the leadership role. And I've never been the infection control person, but I remember 2 weeks ago, we got together in the office just to talk about the new normal, the new protocols, what we had to do to prepare for opening up. Because in North Carolina, we opened up last week. And I really felt that it is our job, I mean, to be ahead of certain things that the doctor owner may not know about, and that we have to stand up for ourselves. I felt like there were some things that I really wasn't that comfortable with. And, you know, if you prepare before you go in and you know what your opportunity is and what your, you know, the knowledge behind it, and you speak it with a mature tone and with respect, you know, you can make some changes there. And I felt like that is something we're used to running our own show, our own columns, our patients in and out. So we actually have a practice within a practice. And I think that they will listen to us a little bit more sometimes, and we can show, we can just kind of, through our experience, set the right example. And I do believe, as Tanya said, leadership is going to be key. And it doesn't matter what position you are in the office, leaders will emerge through this chaotic time. And it's a great time to show that.
So one of the things Ann talked about, and we'll get back to, is this idea that I'm a hygienist, I want to be a leader in the practice, but sometimes I have to deliver news that somebody may not want to hear, or I have to make a sort of a controversial position or take a position. Who's had experience with that, and what's the right way to do that if you're a hygienist out there and maybe you have an opinion that you're afraid might not be welcomed by somebody or might be a difficult one to say? I don't know if anybody wants to chime in on that one. Is that an experience anybody has had?
I can chime in on that.
Yeah, Donna, go ahead.
I can chime in. I really think that hygienists are used to being solutionists, but I think now that we're in a different time where there's a lot of obstacles that we are facing, and sometimes we kind of go in with a little bit of the problems without the solutions. But we have that in us. We have critical abilities, critical thinking abilities, but already go in with a plan. Have solutions, come in with solutions, have those solutions ready. It may not be well received, but at least have solutions available rather than adding to the problems of it. Mm-hmm. And also we need to collaborate more. I mean, I feel like, you know, we just need to be able to have communications available and open communications, especially with our doctors, and not necessarily in front of the rest of the team. More of a one-on-one. Doctor, what are your expectations? You know, how can we be able to work together? Here's where my concerns are, but here's some of the solutions that I found along the way. So it just doesn't come across as being, you know, confrontational. We can use those leadership abilities to be able to put us in a really favorable position, and it's win-win for everybody.
And Donna, that's a great point.
Oh, good, Ann.
I think.
Okay. No, sorry, go ahead. It's one of those awkward Zoom moments. Hold on, Tanya. Ann, you go ahead.
Well, I was just going to say that's such a great point. No one likes to be called out in front of everybody, and I think that it is, you know, and you know, one of my mottos is, you know, honor people in their absence, and no talking behind someone's back. So if you have a problem or you think you can help somebody, go directly to that person. And even the same thing with the leader, the owner of the practice. I think that it doesn't always have to be in the morning huddle. A lot of times, especially with someone like me, like I have 44 years experience, right? So I feel like a lot of times I'm almost the big sister. I like to say the big sister, not the mama, but I like to be able to, you know, mentor not only, you know, the owner, but also the younger, less experienced colleagues in the office. And I think that helps, just that one-on-one. That's called respect, and it's called lifting your colleagues and your teammates up.
Yeah.
And Tanya?
I really think that a lot of our issues during this crisis, we went through the grieving process altogether, and we were facing unprecedented, you know, event that we've never encountered. And then we went into a fear mode. And, you know, I think that Rachel Wall, she's with Inspired Hygiene, she named it perfectly. She said there's 3 categories. She said there's the ones that were ready and brave to go back. And then number 2 was the ones that were, you know, nervous and cautious. And then you had the ones that were angry, and they were in fear and just attacking everybody. I got attacked. I mean, it was just like for something I was trying to help. And then they came back and I asked them to sit in my shoes, and they were like, yeah, I guess I could have done that in a different way. And it's the how we show up, and it's emotional courage to look at yourself of how you're going to show up and how you react to the situation and calm down. That was everybody was in this this fight or flight mode and wanting just to attack. And that's where I think development needs to be on the teams, is that we need to look at ourselves and how we show up. And if we are able to lead or we're not able to lead, and who is and who isn't on the team. And that's, you know, we're going to, I think, look at our teams in a different way going forward.
Anyone have any wisdom to share about how to get the team working better? What I hear Tanya say is that the next few months may be very stressful as a team, you know, whether it's the team dynamic that's stressful or the decisions that have to be made. Have any of you been part of a team where stress has been part of it? I mean, I think that's true of every team. And what are some of the tips and tricks you can share for how to work better as a team? Alyssa?
I think everybody has said it already, but communication is the biggest thing. And like Ann said, not maybe right in front of everybody else, and not behind their back for sure, because that's just going to cause more tension on the team. So I've actually been really fortunate to work with some really amazing dentists and some other team members that have been really great through all of this. We've been working through all this, just not seeing dental patients. And so, but it all comes back to communication and being able to express your frustrations or your concerns or your fears, and then kind of bring it back to, what do we know? Where is the research? Instead of just coming forward with your fears, like Donna said, coming and saying, here's what I've read, here's the research that I found, and then bringing it to the table so everyone can discuss it and try to find a middle ground. But it all comes back to communication for sure.
Yeah.
And I also think that, you know, we have to give people the benefit of the doubt, as Tanya just mentioned, you know, with what Rachel's going through, the 3 categories. You know, I think everyone is trying to do the best they can with their own personal preferences and resources. And so, you know, like, no judging here, because I just remember in the first meeting with my boss, I was like almost appalled. I'm like, oh my God, he's not taking this as seriously as I think he needs to. And then we kind of all came around as a team together. And so I think that that is really important, is no judging. We're all trying to do our best. Let's just, you know, support each other, acknowledge when something good happens, celebrate the good stuff, because good news, you know, finds good news. And I think that we can set that tone. There's a big tone in the office that I think we can send. You know, there's nothing like, you know, you not necessarily can't hug everybody, but you know, you can give them that encouragement with your words. And that's going to be hard, because, you know, a lot of us are, you know, we care so deeply, and it's going to be a little different going forward. But I do think we can smile with our eyes, and we can, I think, impact those that are afraid, and impact those that maybe haven't taken their profession as seriously as they could have, because dentistry is not really changing. And I think all of us that are in it found that we love it even more than we knew we did. You know, you take something away and it's like, man, I miss dentistry. I can't wait to get, like Tanya, you're going back for get in the trenches again. I can't wait to get back. I'm going back next week. I had to wait for some of the PPE, and I was very fortunate that my boss was very respectful of the fact of my age, and just the fact that I shouldn't put myself in that situation. It wouldn't be responsible to my family, right? But you know, I just really feel this is going to bring dentistry so much closer together. And I think that we're going to respect all the team members. I mean, just think of how the sterilization person is now risen to the top of the ranks, right? I mean, because that is at top of everybody's mind. So I'm thankful for that.
Real quick, I
Tanya?
did take charge of my own PPE. And I ordered a shield, I ordered goggles, I ordered just supplies that I would feel comfortable, because I am temping. So I'm going to go into the office so that I feel comfortable if they don't have what I want, you know. So
that's leadership, Tanya. That's good leadership.
It's taking action. Let's parking lot the PPE question, because that's going to come up. I want to go back to the communication as a starting pointer, because I think it's so important. So the thought that precedes the question is, it seems, from my observation, the main way that offices communicate is through the morning huddle, right? I mean, that's best practice. Every office should have one. Everyone's nodding their head. So going back to work post-COVID-19, what 1 or 2 suggestions can we make about how offices may want to adjust what they were doing in their morning huddle previously? that, to go forward. So basically, what do we want to suggest might be best practices for morning huddle protocol post COVID-19, since communication is important and that's where most of the communication happens. Donna, maybe you can go first and then we'll see if other people have ideas as well. So how should we shake up our morning huddles?
So as a clinical coach, I actually work with teams to be able to provide the best morning huddles that they can. And one of the ways is to create systems and have the offices create their own systems, because they're the ones that are going to be working them. One thing that needs to be revisited is everybody's roles and responsibilities within the home, or in their home, and their dental clinical environment. And that's identifying, going back to your HR books, and if you have them, great, pull up the old roles and responsibilities, have everybody review their own roles and their responsibilities of what they're currently doing. It's probably not going to be current. So review those so they are more up to today's standards, and then incorporate into that what is expected during the huddles. Prepare everybody should have their own roles, and those roles should change. Everybody will take a role as a leader during those morning huddles. Some people will be a note taker, some people will be keeping track of the time and the content, and it should be all, as far as the morning huddles are concerned, they should all be very positive. There should also be 2 additional meetings, at least right now, as transitions are happening and changes happening rapidly, that's taking place during the month. So there should be 2 pre-scheduled meetings, about 2 weeks apart, an hour each, or if longer if needed, but depending on what everybody's needs are, that's going to be addressed there. But morning huddle should always be very positive and uplifting.
Excellent, good. Alyssa, any thoughts on the morning huddle process? Then we'll go to Ann.
Yeah, the only other thing that I can think of, I know I've talked to a few practice owners and they've talked about reviewing their PPE supplies and talking about, okay, this is what we still have in inventory right now, and kind of talking about which patients are coming in that may have aerosol generating procedures or may have longer appointments, and just talking through the logistics of that, because that is something that's new. And maybe talking about, we have this patient coming in and we have 2 other patients coming in after them. What's the procedure for them sitting in the waiting room, or who's going to go out and get them if they are waiting in their car? Just those logistics that are new to everybody. Just again, like Donna said, making sure everybody knows what their role in the process is, and just looking at your schedule for the day and figuring out where you may need additional resources or additional people to help.
Great. Ann, you have thoughts?
Well, I was just thinking it's changing a little bit in the sense that it's changing the huddle. It used to be in the huddles that we would talk about the procedures. That would be the top of everyone's mind during the morning huddles, like what procedures were happening and the logistics, like you said, Elisa, which is great. I think now it's going to be important to talk about the communication of the whole team and the pulse of the patients that are coming in from an emotional standpoint, because everybody's got a different emotion about COVID and the fear of it, or or the hoax of it, or whatever you want to say. I mean, it's from one side to the other. So I think those are going to be important conversations that maybe weren't as important and upfront as they were in the past. Need a little bit more time with each patient, just from an emotional standpoint. I don't know if you all feel that way, but it just seems like that's going to be important going forward.
Ann's making a really good point. I think that's worth spending a minute or 2 on. Is I think as hygienists, we're all trained scientists. I mean, we've all been to school, we all have a degree, and I think what I hear Ann saying is that we have to be a little more emotional. Not just because we understand the science behind COVID-19 doesn't mean that there aren't patients who are, or maybe even team members who are emotional and nervous and scared, and that needs to be dealt with differently than the science of it. So I thought that's an interesting point that needs to be tapped into.
Yep.
Tanya, any thoughts on the morning huddle or the communication style in the office that you want to share?
Yeah.
Tanya,
I agree with Ann. I think that transparency needs to be, can you hear me? I think transparency is very important.
Yep.
being vulnerable in the huddle is, I think, the most important of how the team members are feeling, because how they're feeling is going to transfer onto the patient, and that is where you want to make sure that your mental health of your team member is heard, and where they are in that journey of the grieving process, because that will affect your whole outcome of the patient care.
Well, and you mentioned the word grieving process, Tony. I just wanted to point out that over the course of the United States, probably, what number are we up to now? Maybe 100,000 people have died. So chances are there's someone in your practice who has had a loved one or someone they know from work who has either been afflicted by COVID-19 or maybe passed away. And those people need to be handled gently and with care. I think it's something we can't help but be afraid of, but it's also a truth. Yeah, I think that's smart. Anne, you were going to say something?
Yeah, but what I was talking, yeah.
Well, what?
Hold on. Sorry, Tanya, you go first, and
Tanya?
then Anne, just to finish off what you were saying. Tanya, go ahead.
Yeah, I was talking about how we're having to grieve what our office is not what it was. As a clinician, we're having to grieve a lot of different changes in all of our lives. So that's where I'm saying that needs to be, that's a tender spot for the team members going forward. Because if they're not good and they're not feeling good and they're at different areas on that grieving process, that's going to affect patient care. That's where I was going with that. So thank you.
That's true as well. Anne, you were going to say something?
Well, I was just going to say, I got something from Rachel Wall the other day. She's a good friend of mine, lives in Charlotte. And she was talking, I think this is a time for us to reset dentistry a little bit. And it has to be a team effort. So she was coining the phrase full service dentistry. So I think that is really great to start that off in our operatories. And I think in dental hygiene, for starters, I mean, for sure, this oral systemic issue is really going to come to play here. We're going to be taking blood pressure. We're going to be looking at the whole health of the person. That's going to open up a lot of conversation with people in general about dentistry. So I think that's a role that we can play. And also the fact that they want to maximize the time they're in the office, right? So, instead of doing watching a crown on one side, I was at the post office recently and ran into somebody 6 feet apart, of course, that was one of my patients. And she was like, oh gosh, I'm so bummed out. I didn't get this crown done, but last month or last year. And now I'm so afraid to chew on this side because I can't get it done. So the fact that the public cannot get dentistry done has made them say, oh, I should have gotten this done. I shouldn't have the watches. And I think as healthcare professionals, it gives us an opportunity to share that and to sell or to recommend more fully from our hearts, because that's the way we want it. We don't want people to be worried about their dentistry if they can't get it. And again, reset some of our communication as a team. I think it's just going to help maybe to grow the practice, grow people's respect of dentistry, that it is essential to have a healthy mouth just because it affects everything about the body, and to have those conversations that we may not have felt so strongly about, because some of the things we're doing for them is going to prevent them from getting COVID-19 because they're going to be healthier. So I think just tying that all together and bringing that kind of verbiage and communication up in the morning huddles would be very beneficial.
Yeah, I mean, you raised a good point that made me think that for many of our patients, we're probably going to be the first healthcare professional they see in a long time, unless they've been in the hospital, because all healthcare has been shut down for a while. So being cognizant of this oral systemic connection that you talked about, I think is really important. Taking their blood pressure, making sure they're healthy, looking for symptoms for COVID-19. I mean, it could be that there are patients who are in the chair and they have a bigger healthcare issue than just the dentistry they came to have treated. And I think we probably will see that a lot. Any tips anybody has for the hygienists who are listening about how they can handle the overall healthcare concerns that their patients may have that go beyond just the oral cavity? Alyssa, any thoughts there?
All right,
Alyssa,
chime in. Yeah, so we've talked a lot about communication within our team, but I think this is a great conversation to talk about communicating with our patients, both before they come into their appointments and once they're there. Katrina Sanders, who's another hygienist most of us know, she shared a video on her Facebook page of a local gym that did a video of their gym and all the new precautions they're taking and how they're cleaning things and how they're prepared and how it's safe to come in. And she encouraged dental offices to do something similar. And whether that's a video or an email or phone calls to your patients, just talking to them, addressing those concerns they may have and talking about things we were already doing prior to this and new things that we're putting into place now to make sure that they're staying safe, just to kind of alleviate those fears as they're coming into our office. And then, like Ann said, talking about not just the dental procedure they're going to have done, but how this is going to impact their overall health, and that messaging to show them why it's important and the role that we can play. We're, as hygienists and as dentists, we're natural educators. That's something that we have always done, but it's time for us to kind of take that up a step and talk to them about the importance of their oral health and the things that we can be doing to help keep them healthy. So just communication overall, not just within our teams.
Donna?
I couldn't agree with Alyssa more, especially, this is an opportunity for hygienists and doctors and their teams to hit the reset button when it comes to how they're looking at their patients. This gives them the opportunity to look at their charts ahead of time and see what their risk factors were that we didn't identify last time. What were the areas of bone loss that we just kind of put a watch on? Are they going to be, do they have risk factors for cariogenic risk factors? Are they more at risk for developing caries? So put all of these in your thoughts and even putting it into a list so that when that phone call comes to the patient, especially if you can see that that patient, based on the ALARA principles from the ADA, are due for radiographs. That could be a conversation as we want to do a dental physical on you. You're used to seeing your medical doctor, and now in awareness of everything that's happening within the world, we want to make sure that you're seen comprehensively. We're not just looking at the oral systemic link, we're looking at the entire body. And so this is a great opportunity. Instead of having to schedule prophy, perio maintenance, and feeling burned out because you're wearing all of this PPE, step back, hit the reset button, and see your patients more comprehensively and be able to work as to what the priorities are for that patient. May not always be hygiene. It may be emergency needs, it may be doctor needs. So those are areas to work with your whole team on.
So from a practical standpoint, I assume everybody's going to start taking very helpful. I assume that everybody's going to start taking every patient's temperature, right? So that's the basic, that's certainly the recommendation. Are there any other, and I hope that everyone's going to implement the ADA's health screening protocol that was published a week or two ago. If you haven't seen that, make sure you Google the ADA return to work interim guidelines. So that's absolutely something. But in addition to the temperature screening and the patient screening, what are some of the other pre-appointment changes that we should be recommending the hygienists do, or just officers in general? What other questions should be asked? What other protocols should we put in place for a post-COVID-19 world? Anyone have ideas around that?
Well, we Sure. Within the Hygiene Association, one of the things that we've been talking to a lot of our members about is utilizing, whether it's a phone call or maybe utilizing some telehealth opportunities that you have to really reach out to those patients and have conversations with them about their health during this time and things that may have been happening. It will help kind of transition your practice back in, but it also helps you prioritize which patients may need to get in sooner. Because obviously we have a lot of patients whose appointments have been canceled for the last 2 months, and we don't need to just kind of pretend like that didn't happen. We need to reach out to those patients and see where they're at, and that'll help our practices prioritize. So that's another role that the hygienist could be taking in your practice, is be that kind of care coordinator, care manager for your patients, and take that proactive step to reach out to them and figure out who needs to get in sooner.
Other thoughts?
I think this is a great time for hygienists to step up again to leadership. It's a common thread that we're all talking about, because you need, to get involved in, and Chuck, you mentioned it, the ADA recommendations. So many of the hygienists that we know and don't know aren't even plugged in. And I think this is the time for us to get plugged in to like organizations, whatever it is, to the webinars, to what you guys are all doing at Benko is just fabulous. Talk to your reps, talk to, be that person, the conduit, because we have a great education. I love hygienists. Okay, I'll say we're smart. We can run a business. We're creative. We love people. There's so many wonderful attributes about a hygienist that loves the profession. I mean, some people don't like it, but they maybe should have chosen a different profession, and that's okay. But I just feel like this is our time to shine, because again, that oral systemic connection is so important, especially when you think of COVID not going away anytime soon. And if we don't address, and you mentioned it, Chuck, you're not going to go to the doctor unless you have a problem, or unless your annual physical is due. So people are going to be going to the dentist, and there's so many things, and Donna, you said the same thing, that we could actually, which I would love when I go back, is that checklist. I think it would be really great to have a checklist that we went down on all the different relationships to being susceptible to something like this, and look at it in their medical history. Because we kind of skim over some of that. I'm not going to lie. I mean, I'm busy trying to get everything else done, but I think this is going to change it just a little bit. It may not be, we might be spending more time, not in a clinical procedure, but in a conversational procedure to show the patient how much we care and how important dentistry is. I think it could change how people view dentistry.
I want to revisit something, Ann, that you kind of hinted at before, but I want to go back to it, and that is, by all the reading that I've done, it seems to me that we're going to adopt a new protocol in dentistry, which is there are some patients who, for a variety of reasons, all good ones, we're going to turn away, right? We're going to do a pre-appointment screening. They're going to check a box. It's sort of like if you go to give blood and they say, have you been to this country? And then you have to check a box, you have to go home. It's not something we're used to doing in dentistry. So it could be that the hygienists or the front office folks or somebody else has to have a difficult conversation with a patient and basically say, I'm sorry, Mrs. Smith, I don't think you should get treated today. How do you have that conversation? That's not something we've normally done in dentistry. You normally, once you have an appointment and you walk in the front door, you get treated. And there may be times when in the next few weeks, months, we may have to say to somebody, I'm sorry, I don't think you should be treated today. Why don't we reappoint you for later, or you need to go see a doctor or something like that. How do we have those uncomfortable conversations? Tanya, any thoughts on that?
I had it happen to me. I came back from Australia. I had a conference there, and the conference got canceled. I flew back and I went to my doctor just for my checkup. And he asked me, he's like, have you been out of the country in the last 10 to 14 days? And I was like, yes, sir. He's like, okay, you need to leave. And he really didn't have the—
That's really a great bedside manner right there. Okay, you need to leave. That makes you feel loved and wanted right there. Okay, good. Maybe we can do better.
So, yes, I think we can do better. We can explain that we'll reappoint you at this designated time and get you back on the schedule so we can get you in. But there's a protocol now that we have to abide by. And I think there's a way to do it professionally. So, yeah, I had that happen to me firsthand. So I will be gingerly with my patients.
Yeah. Was it handled well in your experience?
They just told, no, it was not just told.
No, it wasn't. Okay. All right.
I was chuckling
so
because everybody's, it was in the beginning of all the corona and everybody's like, frantic about everything. So, yeah, it was. It is
definitely going to be something different that we need to do in the offices. Yeah. And we need to make sure it's handled sensitively.
Well, it was handled out of fear is what it was.
Yeah. Yeah, I'm sure. Ann, you were going to say something?
Well, I say that's why you talked, as to Donna's point about talking the morning huddle. I mean, that would be a conversation you might want to talk about because it's for the greater good, so it's not because we don't want to see you. And then you have to be able to express that. And maybe a light bulb will go on to somebody that maybe haven't thought about the fact that, there's a bigger reason. And it's just not that we don't want to see you today, but that it's better for you. We wouldn't want to exacerbate any problems that you have, and it's better for the world, I mean, in general. So again, that's good stuff.
Donna,
I was-
Donna already has a checklist.
Oh, good. Oh, Donna, do you have a checklist?
I said,
Somebody said, do I have a checklist as far as?
Yes.
Oh, yes, of course we have checklists.
A lot of checklists. All right, good. So if you could share those later with the attendees, that's awesome. Donna, do you have any thoughts or tips on how to have an uncomfortable conversation with a patient?
You know, I do. You know, I'm a huge advocate. Alyssa had touched on it too. Let your office know ahead of time what you all are doing. So when those conversations come, at least they've been, you know, at least they've been informed ahead of time. But also, I think it's very important not to just dismiss that patient, but to set up an appointment for 15 days. We're going to call you and we're going to check in to see how you're doing. So we're going to be checking and following up with the well-being of that patient, because otherwise, you don't want to just dismiss a patient because they don't pass a test. That's part of the continuation of care. And so maybe we're postponing their appointment, but we're still taking care of them and letting them know we're protecting them. We're making sure that they don't have a compromised immune system. We don't want them going outside, you know, and exposing themselves, but we're protecting everybody in this measure, and just let them know we're really their advocate. That's really important. Patients need an advocate. You know, we're all lost in this, and sometimes we forget about that.
I think too, ideally you would try to not let them come into the clinic just to be turned away. So I think we kind of have to get out of our mold of just like calling to confirm appointments and being like, you have an appointment, great, bye, and hanging up. Really just having more of a conversation during that phone time and talking to the patients about some of those questions ahead of time to determine if they should come in. But then using that opportunity too, we know that most of their oral health is getting taken care of at home. It's things that they're already doing, their habits, their lifestyles that are going to maintain their health. And so using that opportunity to really talk to them about, in this time, maybe we do want to postpone that appointment a couple weeks, but what can they be doing to make sure that they're maintaining that health on their own, and really kind of giving them ownership of their own health too, so that it's not just a phone call saying they can't come in and then we're done. Just using that opportunity to have that conversation.
Good thoughts. So let's pivot a little bit to one of the conversations that got up before, that we started on before, but I sort of pushed it off, and that is this obvious conversation that may be difficult around PPE, right? So PPE, personal protective equipment. There are offices out there that are having trouble getting the requisite personal protective equipment. There have been directives from the hygiene ADHA that have been different than the ADA directives, which I think is the first time in my career that I can remember that the ADA and the ADHA have not been on the same page. So I know there's a big stress out there. From the hygienist perspective about what they feel they need, and it's scientifically based, and what the dentist can actually get access to. Tanya, you said before you purchased your own personal protective equipment where you could find it. So let's talk a little bit about what is our recommendation for the right personal protective equipment, and B, how do we have that difficult conversation with the doctor around being safe? Tanya, since you started it before, do you want to continue that conversation?
Sure. You know, I am in, you know, I've tempted over 100 offices, and I've been in offices that had great universal precautions, and I've been in offices that, you know, did not. And that's why I always took responsibility for some of the things that I take to an office. And, you know, not everybody's going to be 100% of what you want them to be. And, you know, I think that that's when, you know, you've got to figure out what you can tolerate in what office, and if that office is right for you and those core values of that office is right for you. You know, I did go out. I belong to EO, Entrepreneurs Organization, which is a group that's worldwide that they are entrepreneurs that produce PPE, and I've put a list together. Some, like I said, you can purchase big orders or you can purchase small orders, and it's everything across the board. I know that Chuck, you have a lot of you know, expertise in that field, is what Kay was telling me. So I know Benko can provide a lot of that information as well. You probably know more about the hospitals, but I was seeing that the hospitals couldn't get certain PPE, but they also had contracts with people they can only buy from. And then been a shortage. There's been a lot of shortage in that aspect of it too, reported. And you may know more about that. And I've heard it across the board, it happening in hospitals can't work with certain vendors. But that's what I know about PPE in my experience.
Yeah, it's hard to get N95 masks. We are working very hard for it, mostly because the federal government has restricted N95 masks to frontline healthcare workers who are fighting COVID-19 in the hospital setting. So it's not that we don't want to get them, it's that we're not allowed, basically by regulation of the federal government, to sell many N95s. We get them in dribs and drabs, but basically the whole inventory is being pushed towards the hospitals, not the dental practices. That makes it hard.
Yeah, well, and I'm finding like through my EO organization that I can get it easily through my EO, my EO sources.
The problem is some of the stuff is counterfeit, some of the stuff is not as advertised. We at Benko have looked over about 100 different leads for KN95 masks, and all but one or two of them have pretty much been stuff that we don't think meets our standards. So there's a lot of stuff that comes out.
I'll share my list.
KN95, that says KN95, and it may not be. And there have been some articles around counterfeit PPE products. It's not just in dental; it's across the board. Other thoughts on this PPE? Go ahead, Tanya.
Yeah, I was saying these places have a portfolio that that you've seen and saw the pictures from, and they're certified. So I've got a list. I'll share it with you. You might help Benko provide for the dental offices.
Yeah, thank
too.
you. So. Terrific. Other thoughts on how to have that difficult conversation? Go ahead, Ann.
Well, I'm just hoping that, they're recommending that we don't use the Cavitron in some places. I'm just like, there's so many things that I don't want to, I'm really hoping that they will get to the point where we don't have our hands tied, no pun intended, behind our backs, because we know what it takes to give good care and to give excellent care. So, I mean, I think this is just, again, I think we're all having soft openings. And again, we have to kind of like, give everybody the benefit of the doubt. But once we get this thing up and running, we still have to go back and do an excellent job for our patients. And I'm really hoping that they figure that out, that we can all feel safe and know that we can use the equipment that does the best job for our patients, because otherwise what's the point? And I really liked what Elisa said too, is that it's just the other thing, and I don't want to belabor it, but another role for the hygienist is to make sure that they're doing that home care really well at home. And then that's finally our chance to say, hey, you might not be able to get in, so you really have to floss every day and all those things. So that's another great opportunity for us. We might finally get through to some of our patients.
God, we hope so. Donna, you were going to say something?
Yeah, I did. As far as getting everybody on the same team again, this goes back to checklists, but also if there is a cloud-based platform that you're all sharing in regard to who's keeping track of all of the research, because everybody's reading different information, and that's one of the biggest issues that I'm finding in regard to the lack of communication, or hygienists think that they're not going to be protected and the doctors think that they need to have this kind of protection, and we're having this onward discussion, is a place where everybody is receiving the same information, so you're all on the same page. And then in regard to, creating a checklist and say, what are we going to do for PPE? So everybody knows the process, rather than here you go, this is what we're going to have. And hey, we can't get our N95s in. What are our alternatives? What can we look to do instead? How are we going to handle it? Instead of it coming from one person, it really should be a collective effort, but everybody should have like honed down roles, so it's not so confusing, too many cooks in the kitchen. So I'm such a huge advocate on those checklists.
Melissa?
If I can just add on to that too, I think what Donna said, so looking at what PPE you are able to get and that you do have in your office, and kind of structuring your schedule based on what you can do based on your PPE, rather than the other way, saying, this is our schedule, how can we stretch what we have to make sure we see all these procedures? Instead, I've talked to a few dentists who are saying they sit down at the beginning of the week and they say, okay, for the next 2 or 3 weeks, this is what we have. Let's build a schedule so that we can do these procedures safely. And then in some of those gaps, maybe you do have some patients that don't need aerosol generating procedures, and you can kind of fill in those gaps with those patients, rather than just trying to stretch it and make it work. figure out what you can do safely.
One thing that I can say is that, speaking on behalf of the company that's focused on PPE here, we do believe that these shortages, for the most part, the biggest issue, believe it or not, is gowns. But beyond gowns, we do believe the masks, I mean, all this other stuff, the supply chain is going to pick up, and things are going to, this is a temporary situation that we're in. We just need to figure out what it looks like for the next few months, and things will get back to some sort of normal.
I think that's good too, is just telling people it's temporary. It's not, this isn't for the next 3 years. This is like a hopefully a month or two.
No, this is a couple of months, and I don't think it goes much beyond that. So that's the good news. And we're even looking at reusable masks that go beyond the disposable N95s, all kinds of new things, because an N95 can be hard to breathe through. So I'm fully confident that within the next 2 or 3 months, we're going to start to see some new solutions come on the market that we never saw before that will solve the problems that we have. That being said, let's pivot over to the Cavitron and ProfiJet question. The ADA made it pretty clear Cavitron's not to be used. Kind of surprised on my end that they didn't say the same about ProfiJet. I reached out and I asked, and they said, no, there's not a lot of clinical study that says a ProfiJet can be dangerous. That didn't make much sense to me, because I would think it creates just as much aerosol to use a ProfiJet as it does. Look at Ann's face. I love that. Yeah, like I talked to the ADA and I said, what about ProfiJets? And the guy goes, well, there's no study. Oh boy. So are we all agreed that Cavitrons and ProfiJet should be put in a drawer for a little while, and it should be hand scaling and pretty much no ProfiJetting for a little while?
Well, obviously, whoever they ever worn a shield and used a ProfiJet before, because
that's my thought exactly. It's like, what?
I kind of miss that. I'm sorry, Chuck, but my goodness. I don't know. I'm hoping that we'll get the right PPE. There's a couple of different scenarios there that I've heard, because I heard that somebody said that, well, I'm not going to go on that because that's just hearsay. But I'm hoping that we have to get back to that. We have to. There's no way that we can do our jobs without the equipment of certainly a Cavitron, piezo, whatever. We have to be able to break up the biofilm, and hand scaling seems archaic to me. I'm sorry. I've been in hygiene 44 years, and I want to do my job well. So I know that Benko is going to come up with the right PPE, and we're going to feel confident. And to what you all said is that this is going to level out. I've been through the AIDS. I mean, I've been cleaning teeth, or sorry, being a periodontal therapist, before gloves and glasses, and, worked very much in 5 years. My first 5 years was in a periodontal office. So without any PPE. So I really feel hopeful that once we get in our groove, it's going to just, it'll be business as usual again. I really do feel that way, only better.
The good news is I'll tell you what we're looking at. So we are looking at a number of suction systems that we never looked at before that came over from medical. And I think within a few weeks, we're going to have some solutions there. And I hope I'm not speaking up for the industry too much, but I don't think it's too far afield to say that within the next year or so, somebody's going to have a Cavitron that has a suction thing built in. So the advantage that we all have is there is a suction unit in every dental office. Good news. We just have to figure out to get the suction thing to the end where the Cavitron tip is. I just don't think anyone at Dentsply or Hugh Freedy or the manufacturers of the piezos and those Cavitrons have ever had the need to do that before, but I'm fully convinced that within a reasonable amount of time, which makes sense to me, we will have some sort of Cavitron or ultrasonic cleaning system that has a suction built in, and we on the manufacturing industry side will take that tube and put it into the suction system, and as it Cavitrons, it will suck up and we'll have very little aerosol that gets out of the oral cavity. To me, that's the solution. I can't believe that's a huge engineering challenge. I think it's a not too distant future solution. Tanya, you were going to say something?
I just read that where some offices are using, I think it's hydrochloric acid. It's the salt, because the bacteria can't live in the salt, or the virus can't live in the salt aspect of it. So I don't know if that's why the reason, I haven't read clinical studies, but I don't know if that's why they're saying ProfiJet's okay. I don't know. So
that could very well be, but as far as the one who really educated me on that is Dr. Kim. She's on our next panel. So I may call on her to put her camera on and talk a little bit about that, because she's the one who talked to me a little bit about that. But I'm sort of the opinion that ProfiJet should probably not be used, but it's not exactly a directive from the ADA.
And it
So
does
if-
depend on which state is, because
Right.
many states actually are outlining air polishers. So I have seen that in the.
Oh, really? On a state by state level?
Yeah.
I'm
Yeah,
going through the
yeah.
few, I'm going through the questions that were asked. Before we're done, I want to answer a few of them. One that was very interesting was, to me at least, was what should an office do, from your opinion, about medical professionals who are on the front lines of COVID-19 and want to make a dental appointment? So I'm an emergency room doctor, or I'm an infectious disease doctor, and I'm in the community and I want a dental appointment. Should we be seeing those patients, or should we be pushing those patients off? Any thoughts on that? Alyssa?
I'll let Donna take it first, and then I'll chime in.
Donna, go ahead.
Because
Any
actually,
thoughts
my
on?
answer was, there's nobody better than Alyssa that can actually answer that question. Because
There
I
you
know
go,
that
Alyssa,
she
you've been
works
tagged.
with, she actually is working in a medical facility who are testing patients for COVID, that are medical patients that are testing. There's a large percentage that are positive. So with that being said, I don't think anybody better than Alyssa can answer that.
So, yeah, so I was just going to say, I probably am the person you don't want in your dental clinic if you're going to not want those frontline people. I have been working doing our drive-through COVID testing for the last, I don't know, now 6 or 7 weeks. And my dental office did call because my appointment was supposed to be in April, and they wanted to get me back in for my cleaning, if you want to call it that. And yeah, I think it's hard. It really depends on what kind of exposure they have, because not every medical professional or even healthcare worker is being exposed directly for long periods of time. And then you have people like myself or some of our dental assistants you may not think would be the people who are exposed. And right now we are some of those frontline workers. And so I think just again, having those conversations with patients about what exposure they may have had and what settings they've had it in, I feel pretty comfortable because we have been able to have the correct PPE as we're doing those drive-through testing. And we've only had, I think through all of this, I think we've only had 10 employees who have tested positive, and they were in very isolated clusters that they had a known exposure. And so I feel pretty comfortable about my exposure level, but I would like to have that conversation with the dental office to let them know what I have been doing and what precautions I have been taking. So I think that it's a good conversation to have with those patients. I think they're probably educated if they're medical professionals and if they're on the front lines, and they can have that educated conversation with you about the level of exposure and what risk they may or may not bring into the dental office. So,
Other thoughts on that issue?
I just think that's
Go ahead, Ann.
I would like to say that's interesting because, when the AIDS epidemic came around, we treat everybody, we're supposed to treat everybody in the office like they are infected with AIDS. It's that was kind of the mantra. So this is kind of the same type of thing. I mean, I don't know from a legal standpoint, can you turn people away? I mean, that's going to be something maybe your doctors can answer, but I think that's a very good question, Chuck, and just how do we handle that, going forward? Right now, it seems a little easy to turn people away, but this isn't going away. And so I guess if we have the right PPE, we should be able to take care of anybody. And I think the other thing to make our patients aware of, the dentistry's always been very high on sterilization and keeping everything up to speed and above board. And so this is just another level of that. Certainly it's upping our game, but in a couple of months, we're going to have to be prepared to treat everybody because, that's just what we do.
That's what we do. And I'm with Ann. I remember the last time around with AIDS. We both look good, Ann, but we are both older than we look. That's our story, and we're sticking to it.
That's our story.
So that's it. But I remember the first time around, and Ann is right. But I also sense that at least at this moment in time, I don't think it's going to be long term. There is a sense that universal protocols should be followed, but there also are times when certain patients should not be treated. And Ann is correct. That really was an anathema from the 1990s. But and until the whole system is better at airborne pathogens, because bloodborne pathogens were what we were trying to work on through the AIDS epidemic, now it's all about airborne pathogens. Right now, there are gaps in our ability in the dental world to fight against airborne pathogens. We don't have the right PPE in all situations. We don't have the solution for the aerosol. The good news is within a few months, we should be back to where we need to be. We should be as good as effective at fighting airborne as we are at fighting bloodborne. But for that interim time period, there may be times when we have to say to a patient, you're a medical professional, whatever the reason is, now is not the right time for us to treat you in our office. Either we're not prepared or we're just not ready, or it's just we have to wait a little bit. But I agree with you, Ann. I think the goal is in a reasonable amount of time, which I'm hoping is by the end of the year, maybe earlier, we will be set up to fight against airborne pathogens at the same level that we were able to fight against bloodborne pathogens. That's the goal.
If I can just add one thing on to, I think to Ann's point too, kind of what I was trying to say too, is if you just ask people if they're a healthcare worker, that might not give you that much information, because there may be people that you think are not very high risk or not in the front lines, and they may be. Like, you ask somebody, oh, are you a dental assistant? You don't know that they've been doing COVID testing. So yeah, we do need to get to that point where we assume everybody is positive because we don't know otherwise, and we don't know exactly what their exposure level has been.
Yeah. So it's 3 o'clock. I do want to end with one quick question, and it did come up. How would you approach an employer or a doctor who thinks you're maybe being, as a hygienist, overreactive to the level of PPE and safety product in the office? What's the right way to approach a doctor on that issue?
I've already done that. I don't want to chime in. Be yourself, be authentic. It's really, I'm the one that has to look at myself in the mirror and be good for my family, for my friends, my colleagues, my patients. So I would just say, I'm not judging anybody, but I just have to look at myself and do the right thing for me.
That's great.
I think something I heard that really stood out was that if you feel like you overreacted, you probably did the right thing. Because right now it's just that we don't know a lot about this virus. We're still learning things. Information's changing minute to minute still. And so, yeah, we may be overreacting, but wouldn't we rather be on that side of things than to underreact and put ourselves or our fellow coworkers or our patients at risk? And yes, there's a balance in there to find, not to be so fearful that we kind of shut ourselves down, but I think we do want to err on the side of caution until we know more.
Excellent. Well, with that, Alyssa will give you the last word. So thank you very much. Ann, Alyssa, Donna, Tanya, thank you very much for being part of this session today. It was great. We do have a recording up for those who want to listen again. I thought there was a lot of wisdom shared here, and we very much appreciate your time and energy. And you're welcome to stay on and mute your phones and stuff, but we're going to transition over to the doctors now, if that's okay. But on behalf of the participants and the hygiene community in general, you guys are awesome. So thank you very much. Have a great evening. So we'll say goodbye to you. Kay, with that, we're going to activate the doctors who are part of our panel today, if that'd be great.
Fantastic. And I just want to let everyone know while we're making this changeover, we had a lot of Q&A and we really appreciate that. So the panelists are all going to get a list of the Q&A, and we're going to give every one of them the opportunity to answer those questions, because there were a lot of good questions, Chuck. Really a lot of good questions.
A lot of active people. It's great. Thank you.
Andrew,
no, it's really good. It was a good
that.
panel. And one of the things that's kind of cool is, and one of the things, I'll just give the doctor participants a little bit of a heads up. So after we're going to ask you to introduce yourselves, and then I'm going to say, since all of you were on the listening in on the previous session, perhaps you've got some feedback or comments from your point of view, so we can start there and piggyback onto some other issues. So with that, we'll do something similar to what we did before. We have 4 fabulous doctors, dentists, who are part of our panel this afternoon. I'd like to go around and ask them to quickly introduce themselves, where they practice, maybe a little bit about their background, how they got here. And then I'd like to pivot into asking you what kind of feedback you have about any of the issues that were brought up in the previous hour with the hygienist. So we'll start with Dr. Kim. Dr. Kim, if you'll start and introduce yourself, that'd be great.
Good afternoon. My name is Dr. Yusung Kim. I'm a general dentist practicing in Morgantown, Pennsylvania. I guess I could self-claim myself as a research-oriented, scientific-minded dentist, because I'm the type of person who really need to know what it is and how it's working before I can actually implement things. So when Chuck was talking about the hypochlorous acid therapy, I can touch base on that a little bit as well too, and why it works and how it works and why and how I'm going to implement to my practice. Because I think that's one of the most interesting thing about the era that we just lived for the last 3 months, is that when in my life would I actually have a time that I can pause for 3 months, be able to really dig into my field and be able to really understand how things are going to work, even down right to infection control itself. I mean, I literally opened up the book and had to kind of go through the whole thing and saying, am I doing everything right? Did I do everything right? Was I thinking I was doing right? So it was like a complete reset, and I think it's so refreshing. I mean, when do I get a chance to really do a do-over like this? So it's been a really amazing time for me, and also for my team as well too. And so I'm actually excited to be here to share some of those ideas, and then also hear what other people had to say as well too.
Fabulous. Okay, well, we'll come back on the HOCl, correct?
Yes.
Hypochlorous acid. Okay, good. Thank you. You're the chemist. I keep remembering. Dr. Boris, could you introduce yourself?
I'm Dr. Ted Boris. After 32 years of general dentistry in the Chicago suburbs, I became the Director of Scientific Programs for the Chicago Dental Society. Basically, I hire all the speakers for the midwinter meeting and several other small meetings that we have in the course of the year.
Excellent. Dr. Sauer?
I'm Ping Sauer, and I'm a general dentist in Dublin, Ohio. I graduated in 2009 with a PhD in oral biology and EDS. And I'm a startup about 2 years ago, so this has been definitely a challenge for my practice.
Fabulous. So you're a doctor twice.
Yes,
You're
that's what I have everyone
doctor.
call me.
So you have you are Doctor Squared. You have more doctors than anyone else on this panel. So that's we say great. And Wael, Dr. Green.
Thank you for having me. Actually, I just want to start by saying that the previous panel was fantastic. A lot of good information and a lot of words that resonated with everybody, from leadership to communication to the reset button. I think that we all agree that these words keep circling around within our teams and on the panels today. Just a quick briefing on myself. I'm a prosthodontist. I practice in South Florida, a private practice. I've been here 16 years. I went to school in Canada, at University of Western Ontario, get my DDS from there, and I did pros training upstate New York and Rochester. I'm also involved with the CLS Study Club as being a director of study club operations and education as well. So a big part of my role is not just clinical dentistry, but it's education for the dental community. One of the things that came up before, and I would like to circle back to that, is that how do you communicate with your team, and how do you deal with team members who are coming back and saying, you know what, I'm not comfortable with this or that. So we have a couple of things that we've been doing that I would like to share with the group. Please. And with everybody listening. So we'll come back to that whenever you're ready.
Well, let's do that now, and then we'll come back and talk about the chemistry. Dr. Kim hopefully is going to give a chemistry lesson, because I love to hear her talk chemistry. It's very excellent. I'm an English major, so I'm always very impressed. But let's start about this communication issue that came up before, because I do think that that's a good place to start. So Wael, why don't you start and talk a little bit about that?
Sure. Actually, I'm very interested about the hypochlorous acid, because we were using that in our office. I would like to hear you, Dr. Kim, share with us your expertise on that. So we did, when we came back, we did one day before we started seeing patients, where we brought all the team together, and we did a small learning, a couple hours of learning and sharing what is COVID-19 and how we protect ourselves. And then we went into the operatory and went through the process of doing things, with gowns and masks and so on and so forth. And then we thought everybody was going to be comfortable, and everybody is in a good place when we came back. And last week was our first week back, and we did have a good amount of PPEs, but not everything that we wanted, because of the shortage that we have. So we've been having some people coming back, and not directly, because like the panel before, some team members are shy from addressing these issues with us, or afraid, or whatever the reason is. So what we are doing actually today is that we did a survey monkey with a questionnaire. It's anonymous. So we're putting this to our team members. We have about 12 team members in our office. So this way, we went over some questions that are pertinent to the situation, at what they feel comfortable with and what not, and some specifics. So this way, we opened it for them to give us feedback without feeling under the microscope or shy from addressing some of their fears. Because the number one thing is that we have to acknowledge their fears, and these fears are real. We cannot minimize anything from the panel before. It's a personal decision, and everybody is in a different place. So we have to respect that and try to understand where everybody's coming from and try to address it separately.
Gotcha. Other thoughts from anybody? Dr. Sauer?
No, I agree. I think the communication is very key. And I've actually had hygienists and assistants from other offices contact me through my social media accounts, just asking for advice because they never even got a chance to talk to their dentist during the shutdown. And I probably had weekly, once or twice a week with my own staff, and just my team members, just talking about their feelings, and never being dismissive. Like we all said, it's just kind of listening to them, having them come up with solutions, working together on coming up with things together so that they feel like they're part of the coming up with solutions so that they can feel safe. And yeah, I think it's just communication and making sure they don't feel like they're being heard through the process.
Dr. Boris?
Well, I think what you see is that the practices are of two mindsets. You have the ones that are very prepared. They've gone out, they've done research on what PPEs that they need to do, the procedures that they ordinarily do in their office, and then they will take the time to train the staff and work with the staff over the issue. And then you have the other group that thinks, well, you know, we've been through other problems before, and you know, we've been able to overcome those, so it's just business as usual. And they find out very quickly that it's not business as usual. And that's where the problem will lie, is with that group.
Got it. And Dr. Kim, your thoughts?
Well, I agree with everybody. And I think the most important thing is actually understanding why we're needing these PPEs, because it's not just about covering ourselves like astronauts about to land on the moon, but we have to understand why we're at the high risk and how this aerosol and splatter and all those things are working and what means and how you're going to be controlling it. I think everybody knows this, all the doctors and a lot of the hygienists. I'm sure you guys been on CE courses. It's a systemic thing. It's not like you have a one magic bullet, it's going to cover everything. If you have this one thing that's external suction units or whatever it's going to be, that's going to fix everything. It is an overall thing about how you're controlling this aerosol. And it doesn't matter if you have any of the good of these products. If you don't know how to use them, if you don't have the good ergonomics, this is a good time for you to really review your techniques of what you're doing and how you're doing, and make sure you're actually using everything properly in order to get the maximum effect of what you're actually about to use. And I think that's kind of where things come out to be. And when we're doing the protocols in our office, I want people to be safe, not feel safe, because it doesn't matter if you feel safe and have something in there and have emotional fear driven to buy something and think, oh, I have this, so now I'm going to be safe. No. We have to understand what we have to have and how we're implementing it and how we're actually doing it in order to make sure that we are indeed safe. So it goes anywhere from obviously the whole pyramid of, the engineering controls, substitution controls, isolations, eliminations, reductions, and all down to the PPE, which is the core of how we're protecting. But when it's said and done, you're still in the environment of where you're working. So safety does not only come from PPE. In fact, if you have a lot of the stuff that's already there and eliminated a lot of the viruses or the viral loads of the aerosol that it's traveling in, then you're much safer without even PPEs of some sort, right? So you have to understand why and how you're doing this. So that way that conversation is going to be important, and that the knowledge of why things are needing to be, and that's also important as well too. And I think that's where some of these doctors are talking about, not just, do we have a PPEs? That's one of the questions, but you have a lot of different things that has to come in order, including the admin protocol. That's what you guys are doing, right? Talking about screening out the pre-COVID questions and making sure what patients are being seen, controlling the flow of the patients, all that has to be all together. And so PPE is not the only issue. And I really expect a lot of the doctors and the teams to really have understanding of how things are and being able to work together in order to understand how it's going to be safer for not only for the patients and for you, but also for the individuals who are working as well.
So one of the things that Dr. Kim said to me a few weeks ago, no, it's right. One of the things that Dr. Kim said to me a few weeks ago is maybe it's time to retrain your assistants on proper suctioning techniques. And what are we really doing to make sure that we are tight on the protocols in the office that maybe we got a little bit loose on? Some stuff we may have taken for granted. I thought that was a really good comment. Other comments on protocols or communication? Communication, I think, is one of the things we can all decide is important. What is the way? The question I would ask, as doctors, what is the way you want your staff to communicate to you? Dr. Green, you talked a little bit a few minutes ago about a survey monkey, so anonymous communication. So what is your preferred, how do you want to be communicated to if a staff member or a team member has an issue that they want to bring to your attention? What's the right way to do it? Dr. Sauer?
Directly and frankly.
Yeah.
Like you just come up and just express your feelings in a reasonable way, and then and be reassured that it's going to be taken seriously. We're not going to dismiss anything. But the reason why we did the Survey Monkey is because we felt that people were avoiding that because of their own fears. But I think the best way is just direct communication, be open with discussion. We do have obviously our daily huddles that we try to encourage everybody to bring any of these issues, but we also have a weekly meeting that we do that's implemented. It's 1 hour a week. It used to be twice a week, and now went only once a week, that we discuss these things openly. So direct communication is the best way.
Got it. Dr. Sauer, you were going to say something before?
No, but I was gonna, I agree with what he said, and I just think also being respectful, but then I guess the thing I would want to say too is if you disagree on what is needs to happen, it's just still disagreeing in a way that is respectful, but then also like accepting sometimes that you're not going to get everything that you want, and understanding that that's okay too, because personally, I'm doing the best that I can, but sometimes I can't give everything that they want because it could be for financial reasons, or just it might not even fit logistically into the space that I have. So it's just kind of accepting what is the reality of it.
Gotcha. Dr. Kim, do you want to go back and talk a little bit about hypochloric acid? Not hypochloric acid. HOCl.
Right. The hypochlorous acid is a weak acid, and that's been used in many facilities for many times. And that's something that I think we're also coming to find out, is that we're so used to using disinfectants that are just name brand that we do the surface disinfectant for. And that's great as well too. But if you're looking at some of the decontaminations or any type of processes you do in hospitals and whatnot, they even use like a vapor hydrogen peroxide. You guys all know that hydrogen peroxide is a huge thing right now because everybody's rinsing, pre-rinsing, post-rinsing. And did you ever question why we're doing that? I mean, the whole thing is the hydrogen peroxide is an oxidizer, right? So it's eliminating the DNA synthesis and replications and all those different things. And that's why it's actually affecting some of those bacterial load and viral loads as well. So the actual like hydrogen peroxide, vaporized, or even like the spray itself is actually pretty effective in order to get some of this decon going. So if you're looking at some of those N95 decontamination process that people do, it is a vapor hydrogen peroxide as well that they are recommending. So hypochlorous acid is a very natural. A lot of people actually use it as a kind of a clean disinfectant materials that they're using. The way that we're using in our office is that we use it as a surface disinfectant as well too, because you can just spray and you don't even have to wipe down. It's a surface contact of like 30 seconds, and then you know that it is actually good to go. Because you have to also know, like some of these other things you're using, how much you have to wipe. It's like 1 minute, 4 minutes, depending on what it is, you got to make sure that's also how much it's going to be wet before you can wipe it off. So all those things has to be known of how things are going to be affected. So hypochlorous acid is easy in that way. And also we fog it. So we have an ultra low fogger, and then we plug it in. And then the way we do it is before the office starts, we kind of fog the whole office. And then around lunchtime, we'll fog again. And then before we leave, we'll fog again. And again, it's a real low ultra fine particles that it doesn't get wet. It's just, it's getting onto the surface. And then the way that it works is that you guys actually know the precursor of a hypochlorous acid. It's sodium hypochlorite, and you use that for endo. You know that kills bacteria. You know that kills a lot of the stuff and cleans the area, causes sterilization and decon effect. And the way that it works is because they're oxidizers. So when it dissolves, it actually gives water, chloride, and then hypochlorite, and then just electrolyte. So the way that it actually really works is that it inhibits the glucose oxidation, and then it also inhibits the DNA replication as well too. And then a lot of the really important thing that we noticed is that the studies have shown that it actually caused the post-translational modification of proteins, which is important for bacterial world that we were talking about before, but COVID world, it's the RNA synthesis that was an issue. So that's why it's effective with the hypochlorous acid that's becoming effective in what we're doing. So that fogging thing works really well. My team we are actually pretty good with a lot of the PPEs, but the one thing that we're really struggling with is gowns, right? Because we just can't get them. And if we try to get them, they're so expensive. So we're being very cautious about how we're using it and what we're using it. Can we reuse them? So we actually try a couple different things. We actually washed the gowns. It worked. So the dirty ones, we just kind of put it in our bin, and then in a low cycle with like a wool light, almost like you're doing a wool cycle kind of thing, and we washed them, and they were fine. I mean, we were able to use them. And then another thing we're doing is in between patients, sometimes you're like, if it's not like completely like bloody and like all nasty, and then you think you can reuse them, we actually sprayed with a hypochlorous acid and then get them dried up. We talked about doing it with like a capicide and stuff, but then people are like, oh, we don't want to have a capicide against us. Because another thing that I noticed with a lot of patients that were, a friend of mine is a dermatologist. She had noticed a lot of contact dermatitis that were coming out with the people wearing the mask all the time. And then some of the other things that you're kind of getting exposed to. So we're trying to also keep things safe for our team members as well too. So it seems to work really well. So, you know, I think somebody said it in the previous panels, we are solution-driven people. I mean, that's kind of who we are. So I think we know what the problem is, but instead of like arguing about the problems, like, oh, how come we don't have PPEs and whatnot, see what you have, and then see if you can find solutions of where it is, because we're smart, and you guys are, you know, we're all smart individuals. We can do that. And I think that's important to kind of, communication part is important. Everybody gets an idea going, because all those ideas that everybody's talking about, it's all coming from the team. They're like, oh, can we watch this? Try this? What about this? What about that? So we try it out, and then it becomes our protocol at that point. So I think it's something that's important for everybody to understand. Yes, we do have a lot of problems, but we do still need to see patients. We are, yes, you know, we're kind of whatever, fourth on the list for the priority list for the PPEs, but at the same time, how can we make it so we can actually do what we love to do and be passionate about what we're doing? So that's, I think, important part when you're communicating with people, being able to kind of understand, and then their ideas are not being squashed down. I say no ideas, like no stupid questions, right? So whatever they're asking, yeah, we'll try it. Why not? You know, because we got nothing to lose. And then our protocol gets fine-tuned and tweaked, and then they understand how things are going to work. So I would recommend looking into hypochlorous acid. It's expensive. I think that's really the cost issues. Like sometimes you get a gallon of hypochlorous acid right now for about $80. So they're pretty expensive. Some of them you can dilute it 1 to 10 if you're doing surface disinfectant. Sometimes if you're doing a defogging, you got to kind of see what the concentrations you're going for as well too.
Thank you. Oh, Dr. Sauer?
They do have, we make ours fresh every day with the Ecolex, I think that's the brand. And yeah, it's we use 200 parts per million. So it's just to make sure that, I think that's the recommended amount that you're supposed to.
So hypochlorous acid is used widely by food and drug industries because they spray it over agriculture. So if you go to grocery stores, all the vegetables and the fruits that you're getting, they've been treated with hypochlorous acid. They usually use about 60 ppms for those things. But for medical use, they have approved to be used about 200 ppms.
Thank you.
So I have a question,
Dr. Green?
if you don't mind. What are your thoughts about using hypochlorous acid as an irrigation in terms of like putting it into some of the equipment that we have? Because some people are recommending to put it in the ultrasound or like in the hygiene equipment as well. What are your thoughts on that?
I'll go over to Dr. Kim on the use from it clinically. I can talk more about the equipment itself, but Dr. Kim, go ahead.
Oh, I'm actually kind of quite interested in that because we actually, our hygienists were just talking about that because we had a big meeting, especially kind of discussing what is routine, what is the cleaning, and, you know, what about the 1,000 code versus 4,000 code? Like, where's our, you know, clinical judgment call that's going to be causing, you know, what's causing irreversible damage and what's not. You know, we just had a huge conversation with our hygienist and then came up with a protocol where things are. But that's the exact thing that we actually talked about as well too, introducing hypochlorous acid and then also introducing the hydrogen peroxide itself also being able to be used. Benko has a great product called EcoBalance. We've been using that for ever since it came out, and it's amazing. And one of the main ingredient on that is also hydrogen peroxide as well too. So again, you know, you're doing things that's right for the patients. We have all the tools in our hands actually. It's just understanding how it works, why it works, and then kind of putting it together. That's kind of what we're doing right now, right?
So thanks, Dr. Kim. By the way, I'm a big fan of EcoBalance. I use it myself, and I very strongly recommend it. I think it's a great pre-treatment for everybody who comes in for a clinical procedure. As far as the equipment itself, I'm going to go do some research on that, and I will let you know. I am always reluctant to put any chemical through a machine that has not been tested because you can get clogging and it can start to break down the tubing and stuff. So we will get back to you on that. It's the first time I've been asked the question, so the answer is I don't know. But we should try to figure that out and see if it does make a difference. Maybe in the ultrasonic or something like that, and does it clinically do the job that we need it done, which is if you use the right, if you use something other than water in the ultrasonic machine, the ultrasonic cleaner, does it actually cut down on the aerosols? We should find that out. So we'll find out. So let's pivot a little bit to, we've all been shut down for a period of time. What's the number one insight that you've had in the time you've had off, and or what is your number one challenge coming back to practice? Dr. Boris, you're not really practicing full time now, right? All right.
I'm not practicing at all right now. I'm strictly in the meeting business.
All right.
I think the thing that's most noticeable is the willingness of our profession to accept the webinar format for continuing education. 2 years ago, you said, "Oh, we're going to do webinars." People would just kind of say, "Yeah, that's fine. Have a good time." And today, if you say, "I'm going to have a webinar," you have 700 or 800 people sign up. Yeah. And it's been very interesting to try and make them useful and make them appear at a time when people will be willing to watch. Going forward, as dental meetings are progressing for the future year, many of us are looking at whether the virtual meeting is going to be the way to go for the future.
Mm-hmm. Dr. Green, how about you? What's been your biggest insight in the last 4, 5, 6, 7 weeks?
Again, it was said before, and it's a reset button. We're looking at a lot of things that we have in the practice, a lot of systems that we have, a lot of patients that we have, and we're trying to use this as a launching pad for a new time in the practice, with newer protocols and basically having fun with it. So when we went back, we are actually trying to have fun. It's our second week, and I don't have TikTok on my phone, but I know that most of my team members have TikTok, and every day there's a new TikTok that our office puts out, and just really just trying to have fun with it and trying to bring normal back to life. And there was a webinar that I watched. We're speaking about webinar that Dr. Boris spoke about. There was a webinar that last Thursday through Seattle Study Club that was given by a guy, his name is Todd Williams. And Todd Williams, runs Four Seasons, or training for the Four Seasons hotels. And he did a great program that day. And it's open if anybody wants to watch it. Just go to SeattleStudyClubJournal.com, and it's open. It's free to watch. And one of the things that he said, many things I said, but one of the things that stood out is that he said that when patients come back to us, we have to stick to our core values. We have to do what we're doing for the right reasons, and nothing will change post-COVID. So the time that was before that, we used to reinforce our core values. And the other thing that Todd mentioned is that we are very tempted to share our hard times with our patients, because in our profession in dentistry, we connect and communicate with our patients very well. We know our patients' names, their kids, where they go to school, what they do for fun. So it's very easy when they come and they sit on the chair and say, "Oh, can you believe what happened the past 7 weeks? We didn't work, we didn't do this, and how hard it was on our practice and our team." And it's very easy to get sucked into that. And one of the things that Todd had mentioned is that patients come to us not looking for us to commiserate with them, but looking for us for normalcy in their life. So we try in our practice, and this was a point that we had since Monday this week, is that we said, enough talking about COVID, enough talking about, how things were in the days that we were at home and we're trying to get things back together. We're done with that. Moving forward, we're only talking about positive messaging, talking about we're happy to be back in the office, we're happy to see you guys, we're happy to do what we love doing, and we're meant to be doing every day, because this is the message we want to portray to our patients. But that webinar was fantastic. It was 45 minutes, was one of the best that I watched the past 7 weeks.
I've seen that one, and it was fabulous. So you can probably Google it at Seattle Study Club. Live Life Together, I think, is the seminar series. Yes. Todd Williams is the speaker. Well worth finding. I believe it's available free through the Seattle Study Club website. So definitely recommend it. I liked it very much. Dr. Sauer, what's been your number one insight since this whole thing happened, and how have you changed your practice as a result?
You know, like I said earlier when I did my introduction, I am 2 years into my startup practice, and the shutdown actually made me realize took me off that hamster wheel that I was on. Just the constant like running in this thing, trying to get things going, trying. I realized I was not as efficient as I thought I was, and I just was working too hard and not as I wasn't being as productive as I could have been. So it kind of made me do a little bit more self-reflection, trying to find balance between family and work and taking care of my kids, and also just quite like pulling back a little bit from being so focused on the business, because I wasn't really enjoying like life because I was just so like focused on just keeping it going, I guess. So I think coming back, it's just being more efficient with my time, but also being more balanced at home too.
What are some of the things you've done to become more balanced at home? You know, the work-life balance is something that we all struggle with. We're all busy professionals. So what are some of the things you've done to be more purposeful about that and more mindful?
So it's still an ongoing struggle, I guess, but I have been trying to do a lot more meditation, just also taking myself off technology and off like digital, because I think I was just during the shutdown, like on Facebook, on forums, constantly trying to like figure out what everyone else was thinking, figuring out what was happening. And then it got to the point where I felt like I just needed to pull myself away and shut down a little bit, because when you get all those voices and, you know, it gets to be too much. So I think putting my phone down when I get home from work and not answering those emails right away, and or even the phone calls, and just, you know, I'll get to it the next day. It's just kind of taking a break for myself.
Good for you. And Dr. Kim, how about you? What's been your biggest insight since this whole thing happened? And maybe what have you changed in your practice or in your life to reflect that?
Yeah, I think one of the most amazing things that I found out during this time of closure is that I can let go. I always thought that I have to be the one making the decisions and make things move, but I have an amazing team that just really rose up to leadership. And when the opportunity was given, they completely arose to it and they're running with it. And I wasn't really not a huge micromanager in big picture of things. And this just kind of really made them become the next set of leaders, basically, which was really amazing. So kind of it almost like refreshed me, because I'm thinking, just like Dr. Sauer was saying, I felt like I was like having to run around and do all this stuff, but now I'm kind of going, wow, it can be done. Like they can do it, and it's going to be really amazing now coming forward. So I think one of the things that was challenging for us, and I think still will be, is kind of the lack of leadership guidance from the organizations that are kind of all around it, and not having that consensus, because I think that is actually creating a lot of rift and a lot of arguments, and you know, you name it. I mean, I think everybody sees these things, and it creates a lot of disharmony in our field, where we should be all together and being able to work together with all these things. But one thing that we were able to do is, other doctor was saying earlier, is that we're actually able to have open conversations. They're hearing things, but instead of kind of understanding what can be filtered and what is true and what are some of the opinions that you're hearing it. And it's okay. You can, I mean, everybody's scared right now. We can all talk about it. But having said that, like I just feel that we are the professionals of our field. We're the specialists of our field. We know what we're doing and what needs to be done. It's not to be told by somebody else who really doesn't understand what the industry is and telling us what procedures we can or cannot be doing. That's my opinion in that regards. I understand the bigger picture of things, where yes, we want to conserve PPEs and whatnot. So then one of the questions that I had with my hygienists were, so if we're actually thinking that we have understood the science behind aerosols and the risk factors and how we're going to be reducing things and keep things safe, but then patient is in already for, say, an emergency exam, in order to preserve PPEs, the best thing is to do whatever you need to get done right there for that patient, instead of having them come back. So you have to kind of think logically through it, rather than thinking, well, I'm not allowed to do this, I'm not allowed to do that. Like, who gets to decide that? We do, because we're professionals. We know the best. We were trained for this. So it's not like, I'm not going to be telling my dermatologists what procedures and stuff like that they cannot or can do. I'm not even going to tell oral surgeons what they should or should not be doing, because I'm not there. I'm not the professional in that. So I think all the assisting team and also the hygienists and the dentists themselves really are educated enough to know what it's going to be and how it's supposed to be, and be able to work together as a team as well too. Because I do think everybody is in that, instead of kind of hearing somebody else telling you what to do and then deciding that is going to be right or wrong. That's just my opinion. And that's something that I learned with my team right now. A lot of open conversations, and my team's smart. I mean, they're just brilliant people. And it's been really amazing to kind of come with all that together, because they literally put together all the protocols, getting all the information from everybody else. One thing we learned yesterday, because we did an N95 fit testing, half of my team failed. 95 did not fit anyway, right? So because we can barely get, one size. So, we're doing it because that is the OSHA regulations, and we got to get that checked off. We had a certified person come in and do all that. So now you got to have a contingency plan. So yes, we're going to have all these things. We're going to have a respiratory program, and then now we're going to have a contingency plan of how it's going to be and what it's going to be. So again, I think we have to understand the logic behind about why it's and how it is, rather than just kind of hearing all these things and just kind of saying, oh, there's no PP, so we can't do this. Well, let's see why that is, and then how we can actually go about that. It was really refreshing to really have that open conversation with everyone and being able to come up with solutions.
It's certainly is stressful out there, and you're absolutely right. And explaining the why is so important. And we do work with people who are very bright, whether they're assistants or hygienists or people who work in the front office, and making sure that they understand the why is so important. So going forward, how do we all think that dentistry is going to change post-COVID-19? There's going to be this interim period where we have to get adjusted to things, but what are the changes that we're going to see if you're to look in your crystal ball and say, okay, it's 2021, it's 2022. How will dentistry have changed from this experience? Dr. Boris, you want to take a first stab at that?
Well, I think we've learned that the life that we had could go away in a heartbeat, and we would be closed down and not getting paid, and so the certain sense of security has been taken away. As we rebuild from this. Once again, we're examining our infection control protocols as we did in the bloodborne pathogen era to step up to the new airborne pathogens. And once that becomes second nature to us, I think that our practices will again pick up as they had in the past. I don't know that we'll ever go as fast, or we'll ever go to as greater levels of production on a daily basis as we once did, because we'll have so many other procedures involved in switching over our operatories, switching over our clothing, that it's going to slow things down. But a new rhythm has to be established, and once we get there, I think things are going to move.
Mm-hmm. Dr. Green, how about you? Where do you think dentistry, looking into your crystal ball, 2021, 2022, how do you think dentistry will be different from this experience?
I couldn't agree more with that statement, that I think that the pace of dentistry is going to be different. The days of jumping between operatories to check hygiene and do things like that on the fly are going to be very limited. And I think that the patient awareness is so heightened these days that it's going to disallow us from doing that for good reasons. So I think that our schedule is going to be different. Our appointment length is going to be different. That's on that side of things. In terms of PPEs, I do think that we're gonna adopt a few extra things for our PPEs that will become good practice. I don't think that is gonna become as crazy as some people wearing like some hazmat suits and seeing to see patients. But I think we will have a new norm in some PPEs, which is relatively close to what we have. But that's mostly because the patients are going to be demanding that, and they'll be asking for that because they already are used to that. But I do believe one of the biggest changes that we'll have, and I think Chucky will agree with me, and I think that Benko is aware of that, is that the design of the dental practice is going to change in the future. The whole idea of open operatories, I think, is going to change. The whole idea of having these open sterilization areas is going to change. So, moving forward, I think, and that I'm just building a new practice, but I think that the practice I'm building this year is going to be completely out of date in terms of design next year, just because of COVID. I know one of the things that, for example, that we are changing in our practice to accommodate for that is that we're putting doors on all the operatories. We're putting barn doors, for example, because we cannot put regular doors. But I think the big impact post-COVID is going to be on the design of the dental office, not just on PPEs or patient flows.
Yeah, I'll weigh in there and say that we definitely think that's true from the Benko perspective. And if you think about healthcare in general, I don't know of another category of healthcare that has open places where things actually happen. Even in a healthcare setting where there's not the chance of aerosols and air-driven and airborne pathogen stuff, even then, every version of healthcare that I've ever been to has closed doors and closed rooms. So this idea that dentistry can actually do operating work, I mean, it's operative dentistry for a reason, in an open setting, I think is really probably going to be a thing of the past. I don't know that everyone's going to have to close in their operatories next week or something, but going forward, we are definitely pivoting on the design end of Benko to only be recommending closed operatory settings. I don't think there's any question about that. So
I agree, and I don't think that the idea is to have OR settings in our operatories or negative pressure rooms or anything like that. This is going to the other extreme.
Too far.
But I think that we're just going to have to contain the aerosol more, just even for patients' comfort, to understand that we're doing the best that we can to minimize exposure.
Absolutely. Dr. Kim, your thoughts on what dentistry looks different, how dentistry looks different going forward?
I absolutely agree with everybody on the panel. But I think the silver lining of this whole thing is that we're actually going to raise the standard of care that we're going to be giving overall, because all the offices now, I mean, I know the gamuts of the range of the dental offices that are out there, some who are doing dentistry from 20 years ago, still using the same instruments and still doing the same thing, all the way to the offices that has all the technologists out there and then moving forward progressively. Now we're almost kind of getting ourselves onto the reset button of being able to have that standard of care being a lot raised up. And you are not going to be able to do what you were doing before. You have to kind of come to that as well too. But in big picture of things, I think that's a great thing for our field in big, because we're no longer going to be like, like barbershop next to barbershop and cutting the like doing the same thing, those type of things. I think we're going to be that oral health physicians that we are, and be able to be that healthcare providers that we need to be. And that's for the assistants and also for the hygienists as well too. We're going to be assuming those roles. So I think in the big picture of things, I think that's exciting. As far as like actual change of the flow and how things are, I think we're like hyper aware of the stuff right now when it's all said and done. But when you have all the engineering protocols and everything that's in place, I don't think it's going to be so much. I think we're going to have a smaller waiting rooms. That's true, because now we're learning that they can wait outside in their cars. Oh, great, so that's going to be good. And so there are certain things that we're going to be actually sticking with that's going to actually work. Like teledentistry, I think that's also amazing. But what I found out, because we've been doing teledentistry before this whole thing happened, we still have to see patients. I mean, I've already educated my patients that I cannot diagnose you over the phone. You have to come in so I can look at you, And then in order to actually do the work, they have to be in your chair for us to do it. Unlike medicine, sometimes you can just do consult over the phone. But it's going to have a good effect of kind of going in. I think a lot of things we're going to be chartless and contactless and all those things. I think that's going to be huge. I know Dr. Sauer was talking about efficiency. I mean, talking about getting all that stuff done prior to all the patients coming in, being able to get that efficiency level going. That's amazing as well too. I think your teams are going to be better trained with everything and be more aware of what's going on, because now like all my teams are basically all getting cross-trained, because we're getting patients checked out in the chair side and being able to leave without they have to come to the front. So now it's not something that you kind of go, oh, it's an optional. No, it's a must now. So there are going to be a lot of things that we're doing right now that's going to become a must for us in the future. That's going to be good. That's going to be good for our field, and everybody's going to be feeling so much better because you're going to know better, and it's going to be so nice in that regard. Like I agree with the doctor. Well, it's like, the whole negative pressure thing drives me nuts, because when it all said and done, negative pressure, basically you want to have the pressure outside that can draw the air better out instead of recirculating your office. That's what negative pressure is. So honestly, if you really want to do that, you could open up the windows, or you can open up the door and then put a fan so the air blows out. That's negative pressure for you. But having said that, that's not how the dental office is going to work, in infection control setting. But that's kind of the things that we always talk about. I'm like, I want people to understand why they're recommending certain things and why things has to be done in certain ways. And we're getting so better educated in that. And I think that's going to also drive the dentistry to the next level that it should be. And I just think dentistry is going to be literally become dental medicine, because I think that's what Chuck was talking about earlier, the whole systemic issues that we're talking about and how things are. So we're getting more educated, and we're actually setting ourselves to do that as well too.
So, Dr. Sauer, you're the one that I've not asked a question to, but I'm gonna punt a little bit, and I'm gonna say, since you're the youngest member of the panel, look into your crystal ball, and how do you want dentistry to be 10 years from now? Some of us may not be around in 10 years. Dr. Kim's gonna be around. Dr. Boris, I'm not sure about. Well, you better be around in 10 years. But for some of us, 10 years is a long way in the future. So as you take out your crystal ball, how do you see dentistry in 10 years?
Oh, I haven't really thought about that. I guess what I was gonna say though is I feel like patients now, and I've even seen it in the 2 weeks that I've been open, have been more willing to do their treatment now instead of putting it off. So I had a patient that I diagnosed fillings a year ago, and then he was finally like, I couldn't even, like, it became an emergency during the pandemic, and then he realized he can't put things off because I might not be there to be able to even do a filling because that wasn't considered an emergency. So I think now they're more like, I want to get all this stuff done now. And I'm like, oh, well, we kind of have to space things out a little bit. Dentistry is going to be a little bit slower, but to be honest, even after just 2 weeks of doing it, everyone's starting to get back into the routine. Even with the changes, it's still, we don't need to elongate the times anymore. Everyone's starting to understand how to do it, and they're doing it well, and they feel they're doing it in a way that is efficient. So I think I don't want to say it will get back to normal, but I think people will find their routine again, and it'll go back to how you want to do things.
Talk a little bit about, Dr. Sauer, talk a little bit about why you decided to get into dentistry. What attracted you to the profession, and are you still happy with the decision, even though dentistry has probably changed significantly even in the short time you've been in? And so what attracted you, and what do you hope to get out of it as time goes on, through the course of your career?
So, I've always liked interacting with patients. I like working with my hands. I like science. I like medicine. I had gotten my PhD. Eventually I'd like to go back to academia, but it was actually doing patient care, which was really what I fell in love with in dental school. And that's why I went on to practice instead of staying in academics. And I just, what was the second part of the question?
What do you hope to get out of your career? Like where do you hope to be in 5-10 years as you look things out, and what's changed even in the short time you've been in dentistry?
I mean, it keeps evolving, and I think I keep changing too. As I get older and I have more experience, it keeps going back to that work-life balance. I love doing what I do, but I also want to be able to enjoy my life and enjoy my kids and watch them grow up and be available to them too. And I don't know, it just keeps changing. So I don't know if I can commit to any
all right.
I guess it's just,
no
growth.
So let's pivot to one of the topics that Dr. Boris brought up before, and I feel like we're fortunate in that we have him on the panel today. I think everyone's sort of wondering what's going to happen with dental meetings. There's lots of them. They've been an important part of dentistry for many years, and certainly one of the main things that's changed over the last few weeks has been, as you said before, online, and I don't want to travel, and I'm doing stuff in my house. So as a person who's intimately involved with the Chicago dental meeting, Dr. Boris, talk to us a little bit about what you guys foresee and what we all can foresee coming out down the pike with dental meetings.
Well, Chuck, I wish I had a good subscription to a crystal ball, because right now
we're depending on you now. You're going to give us the answer.
We don't know.
Okay, that's an answer.
The questions that we're facing, and basically there's three groups that we need to be worried about: the doctors and the staff that are coming to visit us, the lecturers that are coming to present for us, and the vendors such as you that would come and exhibit with us. If any one of those three kind of falls off the wagon, then we are unable to give you the meeting that you want. In our case in Chicago, we were fortunate to be the last major meeting to occur this year, all the way back in February. We had no occurrences of COVID based on our meeting, which was extremely lucky. But every other meeting since then has been canceled. As we look towards the future, our governor in Illinois has said that there will be no meetings and no conventions until there's a vaccine or a cure for this bug. So as a result, in our planning for 2021, we don't know whether we're going to be able to put on a meeting just from a legal standpoint. If, you know, it is our goal to put on a meeting, as we've always put on a meeting, but we're preparing on the chance that that will not be the case, and try and work out a program that people will be able to view in the virtual sense and continue their continuing education and that. The thing that is most wrong or most difficult with that is there's a certain aspect of socialization that is part of any dental meeting. You're there to meet with your colleagues and you know, talk about how things are going in your practice or how things are going in your life. Once we get to the virtual standpoint, that will be lost, and we don't have an answer for that.
Got it. Anybody else? Dr. Boris clearly is intimately involved. Dr. Green, you're very involved with Seattle Study Club in the planning of Symposium, which is a terrific dental meeting every year in January, February. I don't know if you have a comment from that perspective on where Seattle Study Club and Symposium and local meetings are concerned.
No, not about Symposium. Symposium is in February. So again, like the midwinter meeting, we still have some time before we see what's going on. So as you know, we had a meeting that was planned for July for the Director Summit, and that was canceled, obviously. And we had another one in April that was canceled for coordinators because that's in the middle of everything that's going on. But yeah, everybody, I think, is on a holding pattern to see what's going to happen next few months. I know that the Greater New York meeting in December, it's still planned, as far as I know, to go on in New York in December, which is exactly like, I'm not really sure how that's going to work out.
We'll see.
I think, you know, as states start to open now, I think the next 3 to 4 weeks, we'll see if there's any spike in the number of cases, and if anything, that will be an indicator or one of the indicators that we will have about how things are going to move forward. But you know, also factor in going back into the fall and then the flu season coming up at the end of 2020. And you know, if anybody coughs or sneezes and has a fever as of September, everybody's going to think it's COVID-20, which might not be. So a lot of things are going to be clear over the next few weeks and few months. But I don't think anybody regarding meetings in 2021 has made any decisions yet. As far as I know, everything's still a go from where it was.
So we're getting towards the end of our time together. I thought I'd give everyone a thought exercise as we close this thing out over the next few minutes. And that is, if I were to give each one of you a magic wand and say, you know, whether it's the 3 wishes or the magic wand, and you could wave that wand and have anything you want within your practice, or whether it's a product or a change or something, how would you use the magic wand going forward post-COVID-19? I see Dr. Kim is smiling, so she may have thought about this before. So
I am not. I would like that magic wand, Chuck.
All right, I'm going to give it to you right here. Here it is. So what would you want, either in terms of a product or some change in your practice or some change? What is the thing that you most want looking forward in a post-COVID-19 world?
If I actually, because we talked about this before in my office too, it's like, if you had like one incredible superpower, what would you like to have? Or like your magic wand, what would it be? Like for me, I actually want patient to come in and I just go, yep, your problem fixed and done. Yeah. Okay. I don't even have to have anything there. Like, so that's the magic of it. That's great. Yeah. But if I were to look at actually technologies that I would like to see developing, obviously, is being able to diagnose things remotely as well too. I think you know, we can do teledentistry, because one of the things in dentistry is that we got to get the radiographs, and we're not able to do that. So we were kind of thinking about, like, is there a way for patients to be triaged before so they can actually be scheduled for what they need to be scheduled for? I think that would be really awesome. I think a lot of the technologies that are evolving, AIs and everything that's going to get involved, I think those are going to be really amazing technologies that we can have. So if something like that, you know, like mechanically, that would be my magic wand kind of wish at this point.
That's awesome. Thank you very much. Dr. Boris, how about you? If we were to give you that magic wand, what would you use it on?
Well, I would use it on young dentists.
Oh.
The great bugaboo of the major dental meetings is what can we do to attract the young dentist? And it's a very difficult thing. And I will tell you that if you had the meeting planners from all the major meetings here with you today, they would agree with, they'd all be shaking their head right now saying, yeah, if I could know what would attract the young dentist, that would make my life a whole lot easier.
Okay. Well, from there, we'll go to a young dentist. Dr. Sauer, you can either answer that question or answer the question for yourself.
I don't think I'm that young.
All right. Well, I don't know. You seem, you're younger than the rest of us, so you're the youngest person here.
I'm in my 40s.
It's all right. My 40s are way in the past, so go right ahead.
Wait, what's the question?
The question is, if you had a magic wand and can make a change for post-COVID-19 in your practice, what product would you make, or what change would you make to make your practice or make your profession better?
I mean, I guess it's the testing, but honestly, reliable testing, but then knowing what that means. So like if a patient comes in, even if they tested that they had antibodies, what does that mean? Does that mean that they're immune if they're not, or if they're, like it's that testing part, the reliability of the testing. And then the other thing is just, if I'm wearing all this PPE, I wish I wasn't so hot. I'm just like sweating.
Yeah, I know, it's a real challenge. I agree with you. No, seriously, we're working on that as we speak, but it's very hot in the office and in all the gear. Go ahead, Dr.
I want
Kim.
to comment a little bit on the testing. So we tested all our team members for antibody tests before they started working, because we wanted to see, because so many people were sick all winter, and we're like, you must have COVID, because I mean, they were just sick all the time. And it turned out that nobody had antibodies. So the ones that you're looking for is IgM and IgG. IgM is the recent infection, and IgG is the protection from the past infection. So we tested for both, and we were all negative for it. But now there's antigen tests that are coming out as well too. And that's something that I'm going to get, and I'm going to try to have my people tested on a weekly basis, because we are exposed and we are being at the risk as well too. And I think that's going to give us some idea. So I think antibody testings, you do it just to see if they were previously exposed and have any type of protection for them. And then antigen testing is probably something moving forward that you can also do with your team as well.
Good comments. Dr. Green?
So
how about you?
I would love to have a time machine just to move forward in time and see what's going to happen next year so we can plan better. But on a serious note, I think one of my passions in dentistry is to use technology, and using technology to create efficiency, which is a very tough balance between creating efficiency and still maintaining quality, high-end dentistry with the efficiency, and maintaining the personal touch. Because once you start using technology, that takes away the human factor from things. And it's just finding the elusive balance between the human factor and technology and a very high quality dental care. I think that this is one of my passions in my practice. I mean, as you know, everything that we have is, all the new technologies and all the new digital stuff, because I do believe that this is the future of dentistry. This is how we can keep the profession going and be able to provide excellent dental care for our patients while maintaining the cost as low as possible by using this technology.
Mm-hmm. Good thoughts all the way around. So in our closing 2 or 3 minutes, any words of wisdom that anybody would like to share with anyone out there as far as what you've learned or any learnings to pass along? Dr. Kim? I'm
going to just say, I know a lot of people are kind of down and negative about what we just kind of went through. I am super excited. And I'm supercharged actually, because as I said, when do I get the opportunity to do over in my life as I'm going along? And that's basically the opportunity that I have. I have all my team still there. It's not like I declare bankruptcy, so I have to come from it or that type of stuff. You have your team, and your patients are actually eager for you to be back and, being able to do what you need to do. This is such a great opportunity in all aspects of things and for the growth. And I mean, I've been doing dentistry over 20 years and I feel like I've been kind of plateauing stuff. And, kind of Dr. Boris was saying, I'm like, oh, what am I going to do for the next 10 years or whatever it's going to be? I'm like supercharged now. And I realized how much I miss dentistry. And I'm so passionate about it. The first time I actually picked up the burr and handpiece, and I was like, oh my gosh, I love this thing. How crazy are we? But that's what we're about. And I think it's so great to find that first love again and being able to kind of get right into what you're doing. So it's been, I mean, yes, it's crazy and we still got a lot of stuff that's going to be ahead of us that we got to do. But I think just for us, I think this is just so amazing. It's an amazing opportunity for us to kind of get back to what we really love to do and have that passion for it.
Terrific. Dr. Sauer, any words of wisdom to close with?
I would just say, everyone just stay strong, stay flexible, and then also just be a little bit, show a little bit of compassion for everyone and just try to understand that we're all coming from different situations. And, it's just try to put yourself in their position and understand why they're making the decisions they're making, or why they're fearing the things that they're fearing. And I would just say a lot of compassion and kindness could go a long way.
No doubt. Dr. Boris, how about you?
I would say to my colleagues, take a deep breath, take a look around, and plot a good path forward. There's been so much fear and uncertainty over these last few weeks that a lot of people are looking for a way out. And that's not the thing that they need to be doing. They need to be looking for a path forward.
Good, thank you. Well said. Dr. Green?
I'll say respect the virus, educate your team, lead your team, inspire your team, listen to your team, and use this as a clean slate to start over again. Like Dr. Kim said, it's not going to happen again, hopefully in our lifetime, that we get to do all over again without having any repercussions to that. It's a great opportunity. Have fun with it as much as possible, because we are going to get better, and the only way we're going to get better is that we do it together as a team, because we're all in it together.
And on that note, I can think of no better way to close today's session. So to the 4 doctors who are part of our panel, you guys are awesome. Thank you very much for spending the time and sharing your wisdom and your learnings. Terrific panel discussion. The 4 hygienists were super helpful. It was great to see there was so much parallel between what people were saying. And I'll close things out by saying, I have never been as optimistic about the future of dentistry as I am today. I lived through, as some of us did here, the AIDS epidemic and the AIDS crisis of the early 1990s. This feels a lot like that, different because it's airborne, not bloodborne, but we will get through this. We will get through it together. And here at Benko, we're proud to be the sponsors of today's program, and hopefully everybody got a couple nuggets that they can take back to their practice. So with that, thank you everybody for being here today. Thanks for sharing, and good luck to everybody as we go forward. So wonderful. Good to see you.
Thank you,
everybody.
everyone. And thank you, Chuck. Thank you.
Thank you.
With that said, I just would like to reach out to let everyone know there was a lot of Q&A questions that came across, and we will answer all of those questions. And then I just want to also give you a little bit of update, because some of the questions that were asked are some of the webinars that we're going to be presenting later. So just write this down. If you want to, you can actually take your cell phone, talk about technology, and there's a QR code. You can scan that QR code, and it's going to give you some of the upcoming webinars that we have. Tanya's going to be doing one coming up on Thursday about employment, and employment's a really big issue right now, and what to look for an employee. So Tanya's going to be on Thursday, May 21st from 12 to 1 Eastern time. And then we're also going to have Paul Jackson. And I will say that Paul is going to be answering a lot of the questions that came across today. Paul's going to be answering. He's going to be talking about the air quality, the flow in the practice, about the new testing that's out that some offices can do. He's going to be really giving a lot of great information on that. So please try to sign up for those 2 webinars.
And with that, Kay, thank you very much. Oh, go ahead.
One more, just sorry. And then if today we talked about communication. So this is a great ending, and this is how we're going to end this. Catherine Attell is an amazing speaker, and she does a really good job on communications. And so she's doing a 2-day workshop on Thursday and Friday, and it really does cover this. It covers how do you communicate with your team? How do you communicate with your patients? And she really lays it out in a very easy form. So I know today, one thing I took away is that in order for an office to really come back and do great, they have to have really good communication. So with that being said, if you're interested in this workshop, please let us know and please sign up. That's it. So again, thank you to all of our panelists. Everyone did a great job. Chuck, you were amazing as always. Thank you very, very much for your time.
It's easy to be a good host if we've got great panelists, and today we had 8 terrific panelists. So thank you very much, everybody. Have a great evening and get back to work soon. Thank you. Bye-bye.
Bye-bye.